Hello, everyone. Thanks for joining us this evening. We're going to wait another minute or two and see if anyone else who joins. And while we're waiting, I'll go ahead and pull up my screen deck or my slide deck. There we go. Great. We'll go ahead and get started. Thank you all for joining us tonight for the first town hall of 2026. We appreciate you being here and your interest in what DSF has been working on and what lies ahead. I'm Marianne Meskis. I'm the Chief Executive Officer, and tonight I'm joined by Dr. Veronica Hood, our Chief Scientific Officer, and Shannon Cloud, our Patient Advocacy Director. And just a few housekeeping rules. This webinar is being recorded, and we'll share this with anyone who registered for the event. Please keep your microphone muted to avoid any interruptions during the presentations. Live captions are available. You can find them by looking in the control panel at the bottom of your Zoom window, and there's a small icon there you can click on. And then please feel free to submit your questions in the chat. If we are unable to address them during the session because we run out of time, we'll be sure to follow up with you via email. And here's a quick look at tonight's agenda. And I'm going to kick it off by talking a little bit about our achievements and progress. So I'm sure for most of you here, you're familiar with the mission of the Dravet Syndrome Foundation, but our goal is to aggressively raise funds for Dravet syndrome and related epilepsies, to support and fund research, increase awareness, and to provide support to affected individuals and families. And we had several really exciting 2025 achievements that are in line with our mission. First of all, we started our legislative advocacy initiative, and Shannon will be speaking a little bit more about this later. But in our first year, we had 3 representatives at Rare Disease Week on the Hill. And we also started a new webpage and offered webinars so that we could make sure to keep our community abreast of any type of legislative policy that was coming up that could impact them, their family, or their loved ones. We also added some additional volunteers to our team. We have a new equity and inclusion committee, as well as our new group of DSF family ambassadors that have started their 2-year term. We really rely on these volunteers to make sure that we're keeping the patient voice front and center in everything that we do and that everyone feels included. And we're so thankful for them for volunteering their time. Through our patient programs, we were able to distribute over 110 newly diagnosed kits, which I think are such an important tool for families new to diagnosis. It really helps give them a starting point and connect them to community. And then we had over 700 birthday buddy gifts that went out to patients across the US. We added 2 new staff members, a database administrator, and a communications and marketing manager. And all of these things happen because of the incredible impact that our community makes through their fundraising efforts. And so last year, through 6 events alone, we raised over $2 million through our galas and benefits. Our Steps Towards a Cure Walk series raised over $250,000. And we had over 1,200 participants across the US who took part in one of the walks near them. During Dravet Awareness Month in June of 2025, we were able to increase the number of impressions on social media by 20% over the year before, and we're hoping to increase these numbers this year. Awareness Month is such an important opportunity for us to make sure that everyone is aware of Dravet syndrome and the unmet need in our community. And then most excitingly, and Veronica will touch more on this later, we were able to award a little over $3.5 million in research last year through 12 projects. And we also hosted our 16th annual research roundtable. Another big thing that we accomplished last year, and when I say we, I should say Shannon, is that we hosted our 5 regional Day of Dravet workshops. These workshops take place on the alternate year of our conferences. And so this year is a conference year, last year were our workshops. And we had over 470 family members who attended, representing 123 families. We also had 65 siblings who were there who were able to participate in SIB camp and connect with other children who understood what it was like to live with someone who had Dravet syndrome. And we had a really lovely partnership with UCB for Camp Small Steps. They designed this really immersive, amazing camp experience for our families that capped off the evening after dinner, and they'll be bringing it to our conference this year as well. In addition to that, we've just had a lot of progress since our inception in 2009, and that's really due to our community and their dedication. We have awarded over $14.1 million in research funding through 84 grants. We've hosted our 16 research roundtables to date, with the 17th coming up in December of this year. We helped to develop 2 expert treatment guidelines, which Veronica will talk a little bit about later. We've awarded over $304,000 to patient assistance grants, hosted 6 educational conferences, with the next one coming in just a few months. Right now we have 7 active clinical trials for patients with Dravet syndrome, 2 of which are genetic-based therapies. And so this is the first time we've had a chance that there could be a treatment that would be disease modifying and control more than seizures. So we're very excited about that. And we've also had 3 FDA-approved medications since 2018. I'm not going to go into a great deal of depth on our finances, but I would encourage you that if you have any questions, to reach out to myself or Jamie Cohen, who is our CFO. You can also scan this QR code or visit the link right below, where you can find all of our 990s as well as our annual audits. But I did want to share the snapshot because it's just so impressive what our community has been able to do over year, and it's really what fuels us and allows us to fund this research. And so you can see the steady growth, but in 2025, we were able to raise over $5.2 million. So a big thank you to all of our supporters and our families. I think for all of us at DSF, most of us have a loved one with Dravet syndrome, or we've become deeply enmeshed with the community. And so everyone really takes the stewardship of these funds very seriously. And like I said, fundraising does fund us. If you have any questions and you want to consider hosting an event, you can reach out to Misty and Meredith. They are there to help you every step along the way. They've developed some nice guidelines to help you no matter what type of event you're having. And then they can also help you to fill out any applications, put together sponsorship packets, just really anything that you need. They can even come and help execute the event the day of. And then if you're looking at unique ways to give, Cheyenne is a great resource. If, for instance, you wanted to do a donor advised fund or talk to somebody about legacy giving or a stock gift, she would be happy to help you as well. And I wanted to talk a little bit about Dravet Awareness Month, which is right around the corner in June. This year, our theme is Purple Drives Progress. And the website page, which is you can find at DravetAwarenessMonth.com or .org, I'm sorry, will be available in early April with all of these updates. But on there, you'll be able to find a variety of ways to participate. And one of the things we're hoping that as many families as possible can do is help us to spread awareness. So please follow us on our social media channels, as well as take a look at that advocacy kit that will be available in April about different things that you can post or how you can present your story to the community and make more people aware of Dravet syndrome. Well, there'll also be an opportunity to raise funds, and I'll share a little bit more about that on the next slide. But some key dates you might want to keep in mind is that from April 12th to May 16th, we'll have our Awareness Month t-shirt fundraiser. This is when we do a unique t-shirt just for that year, and then we make sure to close it in time so that those shirts can be shipped out before Awareness Month begins. June 15th, we'll host our 5th annual Dravet Remembrance Day. We will have a remembrance video that will play live at 12 p.m. Eastern time on that day on our public Facebook channel, but it will also be available for viewing afterwards. And then on June 23rd, excuse me, we join with all of our international families to celebrate Dravet Syndrome Awareness Day together. And if you're looking for a way to participate and help us raise awareness, we would really encourage you to try to join our virtual social media challenge this June, Purple Drives Progress. And our idea behind this is that we'd like you to do a short video wearing something purple, holding something purple, and talking a little bit about your loved one with Dravet syndrome. We're asking each individual to set up a fundraising page to try to raise $100, but also to challenge 2 people that they know to do the same. And we think this is going to give us the opportunity to really amplify our efforts and help to raise awareness of Dravet syndrome. And of course, we appreciate any funds raised for research as well. And you can learn more about that at this QR code or again at the DravetAwarenessMonth.org website. And then the last thing I was going to touch on was our 2026 conference, which is coming up June 25th to 27th. We're going to be in Orlando, Florida at the Renaissance Orlando at SeaWorld. This QR code can take you to the conference webpage that will give you all of the information, including the agenda, social activities, and other things you can expect. If you don't want to use the QR code, the URL is dsfconference.org. And Shannon is going to be hosting an upcoming webinar on April 7th at 7 p.m. That's a guide to attending the conference. So if you've never been to a conference before and you have questions, if you're on the fence and you can't decide to come, be sure to sign up for this as well. It will be recorded if you can't join live, but we would love to see you there. And with that, I'll go ahead and turn it over to Shannon for legislative advocacy.
Hi, everybody. Great to see so many of you joining us live tonight. I'm going to share with you a little bit about our activities that we've been doing around advocacy. First off, the most exciting thing is that we had a great group of families join us this year in Washington, D.C. just a couple weeks ago for Rare Disease Week. In the past, we've had just a couple of staff or board members go to this every year. But this year we opened it up to the community, and we're so excited to see how many people were interested in coming. We were able to sponsor a few families to join us, thanks to some of our partners for their sponsoring of our legislative advocacy program. So it was really exciting to see that we had 20 different family members that were there. Most of us parents, but we had some grandparents, we had a sibling, we even had an aunt and a niece. And so the impact we made was pretty significant. We were able to meet with members of congressional offices from 12 different states. So instead of just a few of us that always go and always meet with our legislators from our states and they get tired of us because we're always back asking for things over and over again, it was really great that we were able to make such an impact and really spread a lot of awareness about Dravet syndrome to so many of these different offices. So it was super exciting, and I will say this, that next year we want to make it even bigger. And so we hope that more people will consider joining us next year. We have considered even potentially in the future, maybe instead of joining this information or joining this session that Every Life Foundation for Rare Diseases does, maybe we should have our own DSF Hill Day, where we're truly just focused on our priorities and the mission for our community. So stay tuned. Maybe that's something that will be coming next year as well. As a part of that event, Gloria Rodriguez and I also attended the Rare Disease Day at the NIH, which is pretty cool to get to go on their campus and just kind of hear from them directly about the different projects and things that they're working on that impact the rare disease community. So you'll see some of the pictures there of our group and people there, and it was just a really incredible time that we had. So what is it that we're advocating for when we do these types of events? So I'm really excited to say that these first two things here that have been on our list for several years now actually passed and were signed into law about a month ago or so. They were included in a budget package that a lot of you probably heard about in the news that had a lot of different things in it. We got really lucky that these legislative priorities got included as a part of that. So I won't spend too much time talking about it since we don't need to advocate for anymore, but I do want to explain why they're so important. This first one, accelerating kids' access to care. This is really helpful to our community because we have so many families that choose to see a Dravet specialist somewhere out of state. And any families that only have Medicaid as their child's primary insurance might not be able to do that because Medicaid isn't accepted by those providers in the other state. So this would streamline the process to make it a lot easier for doctors to see patients that have insurance from other states' Medicaid programs. So that's very exciting. And then the second one is just reauthorizing a program that's been around since like 2012. It is a voucher program which will provide a voucher to any companies that are working on treatments for rare pediatric diseases. Obviously, we don't want communities like ours to get forgotten because our patient population isn't as big as some of the more well-known conditions that are out there. So we really like to see these kinds of incentives because we know it gives these companies a reason to want to invest in our community. And so when these companies are able to get this voucher, it helps get them through the FDA approval process just a little bit quicker, or instead of using it, they can actually sell it to another company. And so it makes these vouchers incredibly valuable to these companies. So again, we're just super excited that we can stop talking about those things now because they finally got through a very difficult legislative environment that's going on right now. The next one is the National Plan for Epilepsy. So this is something that we've been working on with a lot of the epilepsy groups at the national level, um, basically setting up an overall plan that would ensure that anyone that starts having seizures is getting a proper diagnosis and treatments and making sure that the research is happening for cures and things. So some other conditions like Parkinson's, I think, was the one that most recently passed a national plan. So we're hoping to kind of piggyback off of their efforts and be able to get something in place at the national level that will really help make treatment and things better for patients everywhere in the US. And then Genomic Answers for Children's Health Act is a pretty recently introduced bill. And this one is not so much important to those of us that already have a diagnosis, but looking forward, we want to ensure that if there's a child out there that starts having seizures in an infant, they should have access to that genetic testing as soon as possible. And right now, it can be very difficult to get the testing approved, particularly for a patient that only has Medicaid for their insurance coverage. So this bill would require Medicaid to cover that testing so that it doesn't matter what kind of insurance you would have the ability to get those answers at an early age. And then these next few things are not specifically related to a specific piece of legislation, but just things that we're advocating for overall. Obviously, there's been a lot of change in the last year or so with the new administration, and we found that we're not always just fighting to continue things the way they have been. We're fighting cuts that have been proposed. And, it's been very scary to see some of the ideas that have been thrown out in terms of how much there would be cuts to the NIH or the CDC. And so we've been very active in trying to advocate for why the money that has been allocated to those programs in the past is so important and how we need to ensure that we don't lose any of that funding. The good news is a lot of the cuts that were initially proposed last year ended up not happening, or at least weren't as significant as what it could have been. And that's in part due to the advocacy of so many different rare disease communities that have been rallying to try to understand their get the members of Congress to understand how important these programs are. Medicaid. So you probably heard last June when HR 1 was passed that there are plans to cut $1 trillion over the next 10 years. And while it seems like this might not impact our community, we really do have a lot of concerns that it could. We don't know when the states are getting less money, how each individual state who runs their own Medicaid program, how they're going to make those cuts. And it's a very real concern that some of the waiver programs that people in our community rely on, whether it's for children or for adults, some of those waiver programs, because they are optional, they could be the first thing to be cut or reduced. And so it's definitely a scary time. We know, the way that they've structured these cuts is so that most of those things won't actually happen until after the 2026 midterm elections happen later this year. So we're just trying to do our best to make the community stay informed and understand that some of these things coming in 2027 and beyond could unfortunately hurt our families. And then special education, as you've probably heard, the Department of Education has been pretty significantly slashed with the goal of completely eliminating it. And that's where a lot of the compliance for special education takes place. And so that's definitely a real concern for us, that if there's not that oversight, we need to make sure that our states and our local school districts have someone holding them accountable to make sure that they're providing the services that our kids need. So, how are some ways that you can get involved? I'll share about a couple things that we have on our radar for coming up this year. There is a disability policy seminar happening in DC in a couple of weeks. If you're interested, I think tomorrow is the last day to register. I am planning to participate in this one. It's something we've never done before as an organization, so we decided we kind of wanted to check it out and see what we can learn and how we can get our community more involved in advocating for just basic disability rights for our kids. And then the Epilepsy Foundation is having a Capitol Hill advocacy event in the beginning of May. If this is something that any of you would be interested in, please reach out and let me know, because They have asked if we could get some members of our community to participate, particularly if you live in a state that doesn't have a huge population, because those are the states that most often we don't have people coming to DC from. So if you live in one of those states, or anybody though, let me know if that's something you might be interested in. And then Every Life Foundation does an event similar to Rare Disease Week in August, except it's completely virtual. It does not require any travel. It's not a significant commitment in terms of time. They do a quick training and then they set up virtual meetings for you to meet with your congressional offices. So this is a great way for people to get involved and feel like they're making a difference and start establishing those connections with your congressional staffers so that you can continue to bother them in the future when you want to ask them to support things. So again, we'll be sharing information about that, but if that's something you'd like to get involved in, let me know. And then, as Marianne mentioned, Dravet Syndrome Awareness Month. So last year was really incredible when we went back and looked at our social media engagement that month. We put out a lot of content and people were really sharing it. And it was super exciting to see just how many people were sharing and spreading awareness within their own networks. We also had some families that reached out to their city, county, or even state governments to get proclamations to recognize Dravet Syndrome Awareness Day. So this is something that we would love to do even more of this year. We have a guide on our website about how to do that. I'm in the process of updating it a little for this year. But if that's something that you would like to do, please reach out and let me know. We can help you through the process and ensure that it's pretty easy for you to figure out how to do that. In most cases, it's pretty common that if you just reach out to whether it's your city council member or state representative or whoever, they're typically pretty responsive to requests like this. And then if there's anything else that you know of that you hear about, either in your state or anything going on that you feel like we as an organization should be advocating for, or that you personally would like to get involved in, but you're not sure where to start, please reach out and let us know, and we will be happy to help. And then just a few tips for ways that you can stay engaged. As Marianne mentioned, on our website, we have a page, advocatefordravet.org will take you directly there. This is where we post specific calls to action, usually with a link that takes you to an action alert that you can fill out, and it will make it very easy to contact your congressional members so that you enter your address and it knows where you live, it knows who represents you, and it will help you form that email. So it's okay if you don't know exactly what to say. Follow our social media. Anytime we have a real urgent call to action, something that is up for a vote or something, we'll share it out there. There are a lot of other organizations that are great to follow too, to stay up to date with what's going on. Every Life Foundation, Epilepsy Foundation, Epilepsy Alliance America, the ARC, and then all of us have state level organizations too that are really engaged in advocacy efforts. We would love to have you join any of those events I just mentioned. And I also wanted to highlight that we have recently implemented a new online tool through a system called Mighty Networks. And we are setting up a specific hub there just for advocacy. So it's not tied to Facebook or anything. So anybody can join, even if you're a grandparent or another family member. If you want to stay up to date on ways that you can get involved, please let me know, and I would be happy to send you an invite to that. And then lastly, just reach out to your state or federal legislators. Let them know who you are. Tell them about your family and what's important to you. Even if you're not asking for a specific bill or something that is immediate, it's just really important that they hear from us and that they hear our stories and that they understand that the decisions that they're making do impact families like ours. And I'll say that while a lot of what we're focused on is at the federal level, there are a lot of things that happen at the state level that impact us even more than what's happening in Washington, D.C. So it's really good to pay attention to what's going on in your state, see if there's any bills that have been introduced that might cause issues for your family. I know some of the states have already started kind of making changes, kind of headed in that direction of there being Medicaid cuts, knowing that that's coming. I know for sure that Texas and Idaho have both already had legislation on the books that have some pretty significant cuts that would be very harmful for our family. So try to stay up to date. And again, if you hear about something and you're not sure, just reach out to me anytime and I'm happy to help you figure it out. I think that was all I had.
Right. And so, hi, everyone. As Marian introduced earlier, I'm Veronica Hood. I'm going to go over a few just general research updates, tell you about things DSF has funded recently, as well as just some of the long-term accomplishments. And so, again, reiterating, DSF is so proud to have funded over $14.1 million across 84 research projects. We've done that through our annual call for grant applications. Here I've listed the 5 categories that we offer to researchers to apply for. And this helps support research, everything from early career scientists and clinicians just starting to follow their research trajectory, all the way up to more advanced research projects led by more experienced investigators. And we've worked closely with scientific and medical advisory boards over the years to build a research roadmap to make sure we're filling in all those critical gaps in research to make sure we get to better treatments and care for those living with Dravet syndrome. Um, I'm showing here in this graph to the right how funding has grown year over year. As Marianne reiterated at the beginning of the presentation, this is all only possible because of the funds that the community raises. All of those dollars come from the community fundraisers to be able to advance research. And I think you can see in this graph, what's really striking is how much more we've been able to fund in the last several years, which is reflective of us having the funds to fund research, but also the exciting things that are going on in the field. We can go to the next slide. I've broken down here a little bit more to show how DSF tries to fund research broadly across all the areas that are important. Um, you can see here one of the top things that DSF has invested in is for disease modifying therapies. So things that will address Dravet syndrome at the cause of the disease, which are most often going to be genetic based therapies targeted at the underlying SCN1A mutations that cause Dravet syndrome. But we've also invested quite a bit in other areas of research that can try to build things like basic drug discovery, so anti-seizure medications, trying to understand more about the genetics behind Dravet syndrome, understanding the patient journey and what Dravet syndrome looks like across the lifetime, understanding what the networks are in the brain that are impacted in Dravet syndrome and how we might be able to target and correct them. And then we've also invested quite a bit into understanding and preventing sudden unexpected death and epilepsy, which we know is unfortunately a high risk for those living with Dravet syndrome. Our researchers have been really successful. The majority of the research that we've funded has resulted in scientific publications, and many of the researchers have gone on to secure larger sources of funding from agencies like the NIH. And we have also been able to support 21 early career scientists. And it's exciting now to see that several of those researchers that DSF funded in the earliest years of the foundation now have research laboratories of their own, and their own trainees that are now learning and focusing their careers on Dravet syndrome research. And that's all really also reflected in the broader field if you look at other metrics of progress that have happened. And so, as we know, there are 3 FDA medications approved for Dravet syndrome. Only about 5% of rare diseases have any FDA approved medications. So the fact that there are already 3 is very exciting, and there are many more in the pipeline. I'll talk more about some of the things that are in trials right now a little bit later in the presentation. Um, and most excitingly, some of those therapies are genetic therapies that are beginning to show the first data that they may be able to address more than just seizures in Dravet syndrome, but actually modify the disease beyond that. Some of the other measures of progress include looking at how the number of scientific publications have grown year over year. And so if you look in 2009, when DSF was founded, there were about 80 publications that year that had anything to do with the SCN1A gene or Dravet syndrome. And in the last several years, we've been approaching and now in 2025 exceeding 300 papers each year published on this topic. And so the field has grown immensely. The number of researchers focusing on Dravet syndrome has grown exponentially. And then Shannon mentioned earlier the importance of NIH funding. And I referenced in the last slide that several researchers that DSF has funded have gone on to get NIH funding. And so here I'm showing year over year how much the NIH has spent on research directly related to Dravet syndrome. And so you can appreciate here that while it's really incredible that DSF has been able to fund all of the research we have, this progress wouldn't be possible without other players that fund research like the NIH because they're funding, millions of dollars each year into Dravet syndrome research. We saw, up until a few years ago, it was topping $10 million each year. It saw a dip in 2024, and then it held pretty steady in 2025. So we didn't see major cuts, but it still hasn't climbed back up to over that 10 million mark. So it's just really important to continue to protect that funding because it also plays an important part in advancing research. And so I wanted to back up and then just talk about a few of the examples of success stories of research that DSF has funded, or some of the really exciting things that we've funded in recent years that I'm excited to watch. As Miriam mentioned, just last year we funded 12 projects. So this is just sort of a snapshot of things I wanted to show you, but I encourage you to look more at the website and see all the really exciting things that are going on right now that DSF is getting behind. So this first example I wanted to start with because it's actually stemmed from one of the earliest grants DSF funded. We gave a small grant to Dr. Scott Baraban at the University of California, San Francisco to screen large libraries of drugs using a zebrafish model of Dravet syndrome to see if there were any hits on something that might be a good anti-seizure medication. And it seems sort of wild to study Dravet syndrome in a fish, but what his lab found is that zebrafish actually really closely mimic responses to top-line medications that we see in patients, even a little more faithfully than some of the other animal models that are commonly used, like mice. And so it made this model really ideal to use for this sort of screen. And they found that there was this drug called clemizole that was really, really highly effective in these screens at reducing seizure activity. And what was kind of amazing is that clemizole had actually been used years previously as an antihistamine. So we already knew a lot about its safe use in humans, but it dropped off the market because better antihistamines came along. And so when Dr. Baraban's lab looked more in to try to understand why was this helping so much with seizures in the fish, they actually found that those effects were actually probably through its action on the serotonin pathway in the brain. And from all that work, Dr. Baraban was able to start a company called Epigenics Therapeutics to try to develop clemizole and bring it as an option to patients living with Dravet syndrome and related seizure disorders. And we're actually at a point now where that drug clemizole, it's now owned by a company called Harmony Biosciences, and it's in phase 3 clinical trials in patients with Dravet syndrome. And so I think it's just pretty amazing to get to follow that through line. The next example I had, sorry, you can go to the next slide, Marianne. The next example I had was of some of the funding that's gone to Suit Up. And so I showed you on that slide a few minutes ago that we've invested over 1.6 million on research focused on Suit Up, starting with some of our very first grants in 2010. And that 1.6 million, it's actually bigger than that. So these are the grants that specifically focused on Suit Up, but we've also had a lot of other grants that have focused on genetic therapies that we're also finding impacts on Suit Up. So I would say that number is even a little larger than 1.6 million. And Progress has happened. It's been unfortunately slow. SUDEP is really difficult to study. We've seen that recognition of SUDEP has grown. Clinicians are counseling families on it now. Researchers, medical professionals, and families are all focused on it more than ever. Research is happening and people are talking about it. And we're starting to understand a lot more about the risk factors that lead to SUDEP, but we still don't really understand the causes and the biological mechanisms and how we can prevent it. Um, and so what we really need, especially in Dravet syndrome, where we know patients are such high risk, we need to be able to study the genetics. We need to be able to do that in a model where we can monitor brain activity, where we can monitor seizures, breathing, and heart function, which are all the pieces that we think are involved in SUDEP risk. And one of the models that are most widely used to study Dravet syndrome and related disorders are mice. We can alter their genetics and model human diseases really well. And we can look at the brain, the heart, and the lungs in these animals. But the heart is really, really different in mice than in humans. And so Dr. Lori Isom a few years ago set out to develop a rabbit model of Dravet syndrome where she felt like she'd really be able to hopefully uncover more insights into SUDEP because the rabbit heart is much more similar to the human heart. And the gene that causes Dravet syndrome is also expressed in the heart. And so there's been all this interest in that crossover, and potentially that is why SUDEP is such a high risk for these patients. And so Dr. Isom has made a lot of progress developing this rabbit model. That she received NIH funding to develop it, and she's begun to be able to see that there are actually changes in respiration and in cardiac function in this model. But she needed additional funding to be able to continue this work. And so this was a really important moment where DSF was able to step in and supplement something that had actually previously been funded by the NIH and ensure that Dr. Isom can still work on this really important model and help us understand why patients with Dravet syndrome are at such high risk for SUDEP. And so this was just funded last year, so Dr. Isom is still working on this. Some of the first publications from this model are in preparation right now, and so we're excited to watch as this progresses, and hopefully this can lead to really meaningful insights for the community. Um, and so then moving to a more clinically relevant example of a way DSF's been able to have an impact with the research that we're funding are in the expert guidelines that Marian mentioned previously. And so we've actually been able to help fund and participate in the development of two different consensus guidelines from experts. The first was in 2017, and this included expert clinicians and caregivers in the North American region. And then in 2022, we did an updated version that included international participation from the same sort of range of expert clinicians and or all caregivers are experts on living with Dravet syndrome, but we had a portion of caregivers as part of this as well. And what they did is they reached consensus on a lot of different aspects of the care and diagnosis and treatment of Dravet syndrome. And really importantly, what came from that is this neat treatment paradigm that you've probably seen on our website. I see it constantly on presentations at conferences, where it's really what experts have used both their clinical experience as well as the data that is available to lay out which treatments they recommend most highly for patients to utilize with Dravet syndrome, as well as the treatments that should be avoided because they're contraindicated for Dravet. And this has been really important in helping ensure consistency of care for patients, regardless of where they're able to make it for their health care. Mary, we can go to the next slide. And the last thing that I wanted to touch on in these examples of impactful research that DSF is funding is sort of a series of different funding or different research efforts that DSF is focused on that have really worked to gain more information about the long-term trajectory of Dravet syndrome. And so this is also called the natural history of a disease. And this sort of data is really important because it can help identify all the key symptoms of the disorder and improve the recognition by healthcare providers and help them treat the whole disease. It can also characterize the long-term outcomes and identify predictive factors that might help make earlier prognoses on what patients are going to experience throughout the disease course. It can also provide insights on what treatments and interventions have worked in patients previously, as well as provide insights into other factors that might impact outcomes like genetics, environment, demographics. It can also reveal gaps in our knowledge, so what symptoms are just not being addressed right now in clinical care. And lastly, and I think really importantly at this point in time for Dravet syndrome, is that it can also inform and improve clinical trial design, including, the outcome measures that are looked at and how many patients are needed to participate in comparison arms. Right now, there are several studies DSF has funded that are contributing to natural history data collection. The first is something we funded in 2023. It's shown here as generating a shareable clinical genomic data resource for Dravet syndrome, which is a mouthful, but you've probably heard us talking about it as the Dravet Genome Study. And so this has been an effort to do whole genome sequencing on 500 patients with Dravet syndrome to understand more about the genetic background of patients and how that impacts their array of symptoms. And at the same time, they're also getting consent to collect electronic medical health records on those patients and build out sort of a trajectory of what their medical history looks like. And they can incorporate that with the genomic information and get a better picture of the diversity that we see within Dravet syndrome as well as related SCN1A epilepsies. The other two projects that I'm showing here are things DSF just funded in 2025. So these are just getting started. But the first is the one to the far right, Dr. Kelly Nupp at the University or at Children's Hospital of Colorado. She recently began a multidisciplinary care clinic where patients are seen sort of across a constellation of specialists in a day-long clinic there at Colorado Children's. And so now she's launched a study that can kind of utilize that same setup to gather structured information on patients over time. And so this is prospective natural history data, and it's collected in a really standardized manner over time. And in addition to that, this middle grant that I'm showing, we just funded Dr. Danielle Andrade to do a similar longitudinal study where she's looking at natural history data, but in adults, and really focusing in on markers of aging and trying to understand if there are any signs of accelerated aging in adults with Dravet syndrome. I think most of us on the call would know that adults with Dravet syndrome, there's still a lot of questions around what that trajectory looks like. It's been an understudied and under-recognized population. And so we're excited to be supporting these studies that are really looking at Dravet syndrome across the entire lifetime to make sure we have the information to understand what Dravet syndrome looks like and how we can treat it best. And Marianne, if you'll go to the next slide, I'll wrap it up with one more example about sort of this idea of gathering natural history data. And this one sort of also shows how we've invested in lines of evidence over the years. So many years ago, 10 years ago, we funded a researcher, Dr. Dennis Lau, to better characterize SCN1A variants. Several years later, from that work, as well as related work that his lab continued to focus on, he developed something called the SCN portal, which looks at all sodium channel genes and tries to better catalog the different variants and see what we can understand from the existing data from the patient population. Just 1 year later, through a collaboration with Dr. Law and Professor Andreas Brunklaus, they developed a tool called the SCN1A prediction model, which helps clinicians better determine from a patient's genetic results whether they may develop Dravet syndrome or a related epilepsy. In 2003, DSF funded Dr. Brunklaus to begin a prospective natural history study. We just funded a small part of this, but it's very similar to what Dr. Nupp is going to be doing in Colorado. but he was looking at patient populations in the UK. And that data could build more on some of the tools that he and Dr. Lal developed previously. And so this last year, they came to us with a project where they're using that natural history data that Dr. Bronklaus collected, as well as data from other collaborators, putting it all together, strengthening this model they already built, as well as trying to look for new biomarkers that could help us develop better clinical trials. And I think what's exciting about the totality of all these projects that I just told you in these last two slides is that all these researchers are working together. DSF has started a working group where we're bringing them together several times a year to talk about the ongoing efforts with the idea that none of these projects are going to sit by themselves. They're all building data that can benefit the whole community. And so if we can bring them together to make sure that data works together, we hope it's going to have an even larger impact. All right, so those are, like I said, just a few examples of exciting things that DSF is funding. Now I'm going to switch gears a little bit and tell you about some of the exciting clinical trials that are ongoing and some of the things that are in development. And so here I'm showing you the pipeline of therapies that are in development. You can see each line is a different therapeutic being developed by a different industry sponsor. And you can see from how far the blue line goes, whether it's in a preclinical stage, so they're still testing it in a lab, in models, either animal or cell models, or if it's moved into phase 1, 2, or 3 clinical trials, which would be different phases where they're testing safety and efficacy in patient populations. From this graphic here, there are 3 that I'm going to focus in on, the top 3 that are actively in clinical trials that are enrolling patients with Dravet syndrome. And so it's the Deep Sea study, which is bexicaserin from Lundbeck, the Argus study, which is clemizole from Harmony Biosciences. So clemizole I already mentioned from the zebrafish story. And then relutrigine, which is part of the Emerald study from Praxis. And so, Marion, if you want to go to the next slide, I've got these broken down a little bit more. Um, all 3 of these studies, I think what's really exciting about these is they're including patients 2 years up to 65 years or older. And so this is applicable to, patients of all ages with Dravet syndrome. These are all placebo-controlled studies. So each of these are in a phase 3 study. So they're really looking at efficacy. They've already looked some at safety in previous phases of the studies. I've listed where you can find specifically more information on each of these different clinical trials that are enrolling right now, but you can also always visit dravetclinicaltrials.org and see the full listing of all of these studies. The last thing I wanted to call out about these is that you'll notice the Emerald study, I've called out at the bottom that there are opportunities for remote participation. And I don't have it listed here because I don't have all the details yet, but I also know that the Argus trial, so of clemizole, that they're working on options for remote participation as well. So keep an eye out. We'll be sharing that with the community as soon as we get more details on that. That's really unique for this type of clinical study. And I think it's really representative of companies recognizing the burden to rare diseases like Dravet syndrome on having to travel for a clinical study, and they're trying to adapt and bring them to an accessible place for families. So we can go to the next slide. And so I'll end today going over just a few of the genetic-based therapies that are coming down the pipe. These all are targeting the SCN1A mutation that causes Dravet syndrome. And so in Dravet syndrome, patients carry a mutation in one of their 2 copies of the sodium channel SCN1A, which means they only make half the amount of the sodium channels that they need. And this is called haploinsufficiency because it's insufficient to only have half of that gene. And so all of these genetic-based therapies are trying to target that haploinsufficiency and increase the levels of the healthy SCN1A gene. The first of these, that's the farthest along, is zorevunersen. It was previously called STK-001, and it's sponsored by Stoke Therapeutics. We've heard a lot in the news as Stoke just published the data in the New England Journal of Medicine from their phase 1/2 studies that they completed last year, showing not only really profound seizure reductions, but also data that suggests they're having impacts on developmental domains as well. Those were still early studies. It was still a small cohort of patients, but the results are really promising so far. Right now, it's in phase 3 studies. And so we expect probably at some point in 2027 that they'll begin to have the data from those studies complete. And they're already, continuing to have conversations with the FDA as that data comes in. It's really hard to speculate on timelines with these types of studies because there's so many moving parts and a lot of different decision makers in the regulatory agencies. But I think, like I said, that we could expect as early as 2027 for them to be having the data from the phase 3 arms of the study and beginning to talk with regulators at that point towards an approval, which would mean, late 2027 or 2028 would be the earliest we would expect to be seeing that. But again, there's just so many moving parts. We don't want to speculate too closely. The other company that has a genetic-based therapy in clinical trials is Encoded Therapeutics. They have ETX-101. Just in December, they reported out the data from their early part 1 of their phase 1/2 study. It's a very, very small numbers of patients as they were really focused on safety at this point. This is a one-time therapy. It's delivered directly to the brain, and so they're really going slow, making sure it's safe. But they've just released the first data from those patients, again, showing potentially that this could be disease modifying. They saw reductions in seizures, but they also saw positive impacts on development in these early patients. And so they've just been given the okay from the FDA to move on and expand those studies a little bit. And so, Marian, if you'll go to the next slide. I've detailed that a little bit more. So on the left, I have the study from Stoke. It's the Emperor study that I talked about is in phase 3. It's nearly enrolled. They are still looking, I believe, for a few young patients in that study. But on the right, I have the studies from Encoded. So in the US, it's called the Endeavor study. And so they finished the first part of their study, but they're starting to open up part 2, which is the sham delayed treatment and control part of the study. So there will be patients in a control arm and patients who receive the treatment. The patients in the control arm will get the treatment at the end of the study. This is for patients that are ages 6 months to under 48 months. They also have a second arm of the study called Part 1B that they've just opened up. This part is in a very limited number of patients. Just 5 patients are going to be included at first, but this is open to patients aged 48 months to under 18 years, so a larger age range. And this does not have the control arm. They're just looking at safety as a first pass in this small number of older patients. I've listed here, again, this is at dravetclinicaltrials.org. You can find all this information, but I've also listed the websites where you can visit to find more direct information, either from the company or at clinicaltrials.gov. And then Marian, if you could actually go back to that previous slide really quick, I just had one other thing I wanted to mention. I don't have information yet. Sorry, one more back. I just wanted to mention because I know it's coming soon. I don't have any details about a trial yet, but Ionis has indicated their intention to bring an antisense oligonucleotide, so an ASO, similar to what Stoke Therapeutics is developing, that same sort of class of therapy. Theirs is called Ion 337, and we expect hopefully very soon to have information to share with the community about a clinical trial that they've indicated they wanted to start in the first half of 2026. So I just wanted to call that out to look for that information coming soon. And so sorry, Marianne, you can go to the last slide now. Yeah, there's a lot of other ways to be involved in research. You can visit that website and you'll see more than just the trials I called out. There's some opportunities for remote participation, as well as some in-person studies where you can help advance research. So if you have ever any questions about any of these on the website, you can always reach out to me and I can help you navigate all this information.
Thanks, Veronica. Did you want to mention the two that are going to be at the conference?
Yes, so these first two actually that are listed here. So this first one, the AI study of behavior in Dravet syndrome. Right now, there's an opportunity to participate remotely. They just need cell phone videos of patients with Dravet syndrome going about typical daily activities. They're trying to understand if they can build video tracking systems that can tell us a lot more about a patient's status just from the way that they move. But at the conference in June, they're actually going to be there with an in-person setup. And so they would actually be able to do videos of patients in that setup to build their algorithms off. And so if you're attending the conference this summer and you're interested in participating in that, please reach out to me and I can help connect you with that study team. And then the other study, the Dravet genome study, they'll actually be there. If you have not already participated, you will have the opportunity to do to either take a saliva sample kit back home with you or to have a saliva swab done there at the conference for your loved one with Dravet syndrome. Um, and they'll also be presenting at the conference and giving us our first look at some of the results from the patient records that they've been going through. So I think it'll be really exciting if you have already participated to start to see what they're doing with some of that data.
Great, thank you. And thank you, Shannon, too, for those updates. That's fantastic. I'm just always so moved when Veronica presents because as a parent of a 26-year-old, I never imagined that we would see this much progress in his lifetime. And so it's really exciting to see. Let me see, we look like we might have a few questions here. Let me pull this up. Okay, Veronica, this first one is for you. Is clemizole available with prescription outside of clinical trials?
It is not right now. So it stopped being manufactured a long time ago when it went off the market as an antihistamine. And so it'll only be available through the clinical trial right now. And then once approved, or if approved, that company would be the only one who's manufacturing it at this time.
This one is for you also. Why don't we talk much about the gene expression in the heart? Is it recommended to be also followed by a cardiologist?
Yeah, so there's not been major underlying cardiac dysfunction that's been identified in Dravet syndrome. From the research models and from there's actually a DSF funded study going on right now where they're actually looking through lots and lots of patient records of EKGs that are paired with EEG data. And what they found are really subtle signals in the heart. And so there's not major underlying heart dysfunction that's happening in Dravet syndrome. This gene is actually expressed at a really low level in the heart. It's not the main sodium channel that the heart uses. But what sort of the idea is that maybe those really subtle changes, while at baseline, they're not a problem. Could they be a problem under the duress of recovering from a really significant seizure? Could it be the thing that tips the scale sort of in those scenarios? It's really still being figured out, so I don't want to say it too strongly or scare anyone, but it is, I think, a solid hypothesis, and that's why some of these models, like the rabbit model, are going to be really important, as well as, like I mentioned, the studies where they've actually been able to be pulling patient records and looking at is there anything different, even if it's anything different, even if it's subclinical. And I'll just mention several of these research groups are going to be at the conference this summer and presenting on this topic, and so I'm hopeful we can have a really good discussion, not only with the researchers, but we'll also have, clinical perspectives in the room as well to kind of talk about it together as a group. So I'm excited for that.
And it just made me think I should have mentioned for those who are unable to travel to the conference, we will have a live stream available as well. And those sessions will be recorded. So that information will be available even if you can't be there in person. So I see we're coming up on time. I just want to thank everyone for being here tonight. It's really just amazing the power of our community and what we've been able to do together. And that couldn't happen without each of you. So we're so thankful. And we will definitely follow up after this with a link to the recording in case you want to go back and review anything, as well as the slide deck that will give you the links to some of the things we talked about tonight. So thank you all.